My name is Howard Grundy, and both myself and my wife Catherine are retired dental surgeons. Last year, Kath underwent esophagectomy at the Royal Derby, and as such we both had first-hand experience, Kath more so, of the intense working environment that is the ICU. We appreciate the complexity of the treatment carried out in ICU and how dependent we are on the staff and on the equipment. We are therefore very interested in any technology that can help to ensure positive and successful patient outcomes.
So on the SAM project, what we're really interested in is helping treat patients in ICU. So basically, in intensive care, we have lots of very ill patients come in. They need lots of medications given to them, and they're generally given via infusion pumps which pump medications into patients.
Drug prescription, preparation and administration is a deceptively complex process. Drug administration errors are well studied. 73% of administrations are subject to errors against MPSA standards. Intravenous infusions are twice as likely to be subject to errors. A conservative error estimate prevalence of 4 in 1,000 administrations means one significant drug error event occurs every 24 hours in an average 1,000-bed hospital like Derby. A new, clinically driven concept developed by a team led by pharmacist Matthew Elliott and intensivist Dr. Nick Reynolds of the Royal Derby Hospital. This approach synergises the two approaches to offer decision support and detailed error capture for the overwrought clinical user. Process mapping of the traditional preparation and administration of a single intravenous infusion reveals a 14-step process requiring a minimum of 68 cross-check pieces of information. A label printed from the dose administration screen of the prescribing system provides both legible written primary information and the same contained in a barcode format. The barcode can also contain additional advanced information such as the patient's working mass for that drug, dose ranges specific to that patient, batch numbers, expiry dates, and even the correct device required for that infusion. By identifying the patient using a barcode and human checks, all 68 pieces of information required for the successful and safe administration of a drug infusion can be made with the accuracy of a computer database. When the barcode label is presented to the base stock of the syringe driver stack, a vacant pump is activated. This is only after the cross-checking has occurred with regards to the availability of the patient identification, the availability of a prescription for that drug, and that there are no contraindications to that drug administration. The barcode can drive the correct pump program selection and also include hard and soft limits and remove dangerous features such as bolus functions for drugs that should not be bolused. This multi-pump stack showcases how GS1 technology enables the partnership between Archimed Chroma pumps, the AGFA electronic prescribing system, and the clinical users to enhance patient safety.
With some medical knowledge through our own profession, we feel we can bring a very practical patient-based input to the SAM project. It is only natural that patients and their relatives have concerns where autonomous devices are used in a medical setting. We are hoping that our involvement with the SAM project will help to allay these concerns, as we feel there is a real and vital need for this technology in the treatment of patients in ICU.
In the SAM project, we study a number of critical barriers to the safety assurance of autonomous infusion devices. We are talking to different stakeholders, patients, clinicians, manufacturers of infusion devices, and regulators, in order to understand how different people think about the risk of using autonomous devices. There will be situations where the infusion device needs to hand back control to the clinician, and we need to understand in these situations what do healthcare professionals need to know about the decisions taken by the autonomous device, and how can this be communicated in a safe way. When something goes wrong, when a machine takes a decision independently, we need to ensure that we can investigate these events properly. We need to identify the data that we require, and we need to ensure that the data is actually available to us.